thank you for joining our CFO panel today. My name is Jennifer Dahl, and I'm the current chair of the Finance Problem Solving Committee, and I'll be the moderator for today's panel. I'd like to thank the Programs Committee. So you guys probably heard from Sunshine O'Bannon and Chris Grinstead. They were part of the team that helped pull this group together. So thank you to them, as well as to Aaron Coffey, who's my co-chair. So we've got a couple of housekeeping items before we get started. After the session, there will be a survey that will be sent out. It'll be a link in chat. And so we would ask you to take that survey after the session, as well as to go in and look at a survey that will pop into your email on Friday. And so watch for that survey so we can continue to provide the best education to our HFMA members. We also want to let you know that we are going to be monitoring chat, and by we, that's generally me. I'll be monitoring the chat to add in questions to the panelists so that they can answer additional follow-up questions as they provide some responses. So feel free to use that chat. I think quite a few people have already been on there. And so our last thing before we go ahead and get started is this session is sponsored by one of our premier sponsors, Boost Healthcare Consulting. Boost Healthcare Consulting is a consulting firm focused on helping healthcare providers identify and recover revenue. The Boost team works to improve overall revenue by recovering denied and overpaid claims from commercial and governmental payers. So thank you to Boost for being an Oregon chapter sponsor and for supporting our first virtual conference. So we'll go ahead and get started. So we want to welcome the panel to our first ever virtual panel. So we'll see how this works. So thank you guys for being here to share your experiences. I'm going to go ahead and introduce each of you so you can kind of wave to our community as I mention you, and I'll read parts of the bios that you submitted so that people can kind of know where you guys are from. And really, we have a pretty good representation. We have a representation all the way from Portland all the way down to Medford. And so we've got, a good cross-section of the state that is represented. And so we're going to start out with Diana Gernhart. She's up on my left corner. I don't know about everybody else's, but that's where she is. So you can wave to Diana. She is currently the Senior Vice President of Hospital and CFO for Oregon Health and Science University in Portland. And I will also note she is my boss, so I selected her first. Diana is also our current chapter CFO committee chair, and she is a past president for Oregon HFMA. So in her current role, her scope of responsibilities include executive planning, implementing and managing the fiscal health of OHSU Health. Her direct oversight includes enterprise revenue cycle, hospital finance, and managed care contracting. Prior to being at OHSU, Diana worked at Med Partners Milliken and Mercy Healthcare in Sacramento. She received her bachelor's in science, business and management science from Oregon State University. And then go Beavs. Did you say go Beavs? There we go. She said OSU. And later her Master of Business Administration from Portland State University. Diana and her husband Brett live in Portland, and they're active in their local community, as well as being a huge Oregon State Beaver fan. And then along with their two sons, they enjoy water sports and spending time with family and friends. So welcome to Diana. Next, we have Greg Wojtal from Asante. So he is the Senior Vice President and Chief Administration and Finance Officer. He joined Asante in January of 2017. He came from Banner Health as a CFO at Banner Health Network, and prior to that as regional CFO for Banner. Prior to working at Banner, he was a CFO at St. Luke's in Phoenix, also Vice President of Finance in Economawalk Memorial Hospital in Washington. I also worked at the Beaver Dam Community Hospital in Beaver Dam, Wisconsin. and was a worked for a regional CPA firm in Madison, Wisconsin. So Greg received his accounting degree and his MBA in finance from University of Wisconsin in Whitewater. So welcome, Greg.
Thank you.
So our next is Maggie. We have Maggie Hudson, who is the CFO and COO of Santiam Hospital. Maggie's been part of the Santiam Hospital since 1993. There's been a tremendous amount of change and growth within Santiam, and she's proud to serve in that role. It's been in Santiam Canyon since 1953. Maggie's background includes an undergraduate degree in accounting and an MBA from University of Oregon. So we have Diana on one side and Maggie on the other side. They're friendly organizations now, right? There's no more battles between them.
Sure.
Yeah, exactly. Most recently, Maggie has been fortunate to serve on the board of directors for the local CCO, Willamette Valley Community Health. And on a personal note, Maggie is an avid runner, a tennis player, and a proud mom. So welcome to Maggie. Our last panelist is Justin Lyman. He is the CFO of Cenetene Corporation. So welcome, Justin. Justin is the CFO of the Oregon market for Cenetene Corporation. He's been with the company for over 3 years, leading finance, analytic, risk adjustment, and vendor management activities for the Trillium and Health Net of Oregon lines of business. Prior to being at Santiam, Justin worked for Cambia Health Solutions, where he managed the company's cost containment efforts. He also had financial oversight for their Medicare Advantage and individual small group products. He's also worked for Blue Shield of California in various finance roles. Justin also recently served as board of directors for the Ralph House, the largest women's shelter in Portland area. He received his Bachelor's of Science in Finance from Brigham Young University and MBA from University of Notre Dame. So welcome, Justin. So glad to have all of you guys here. Great, very impressive list of credentials from all of you. It'll be interesting to hear all of your comments about what we have learned in our COVID pandemic time. And I do want to give a good shout out to Greg. Thanks for representing from my original home state of Wisconsin. I lived there for 16 years. So shout out to that. But all right, so before we get started with our panel, we would like to do a panel question. So what you see on your screen right now is some information. So go ahead and grab your cell phones or look at the link on your computer and open up Mentimeter.com. So it is showing at the top of your screen. It's actually go to www.menti.com and use the code 682146. So this is a fun tool that we're going to be using within Oregon HFMA to start to do some polling and get some interaction with our membership. And so we're going to use this again at 5 o'clock for our networking event. So we're kind of doing the first to practice. So the question is, what's your current role in your organization? This will help the panelists know basically who's on the phone and who's on the web watching today. So it looks like we have a lot of directors. That's the one that's popping up as the biggest. Some vice president, some project manager, quite a few analysts. So VPs of finance, operations managers, manager of revenue cycle. So hopefully the panel can see that as well and can see kind of who is on, so it gives you a good idea of what our audience is today. But director, analyst is a pretty common word, and project manager, program manager, supervisor. So great, thank you for participating in that particular question. We have one more question for you before we proceed. And the next question is name an important thing that your company's leadership has done to protect the financial viability through the COVID-19 pandemic. So we're looking for things like, did you do supply management, furlough? Did you rely on grants, federal CARES dollars? And so it's just keep it to, a brief question or comment. But again, go into the menti.com. Telehealth is a good call out. That was one I hadn't thought of earlier. Accelerated payments from CMS, the PPP loan and Federal CARES Act. Working from home, that's an excellent one. That is actually on some of our questions as well. So that'll help give our panelists kind of some perspective on what some of the organizations have been doing in order to manage through, COVID pandemic and to the other side where it becomes our new normal. So great. Thank you guys for participating. I appreciate that. And so I think if the panelists are ready, we're going to go ahead and get started. So we sent out a survey question to our membership prior to the conference in order to get some perspective of what they would like to hear about today. And so that was coming directly from the Oregon chapter membership. And we shared those questions with you about a week ago. So hopefully you had a time to read through them. We might not get through all of them, but we will go ahead and get started. And we've grouped the questions for those in the audience into basically four categories. Some finance, general finance questions, some operational questions, labor management, and then vendor related. And so we'll kind of go through them in groups, and then I'll also be monitoring the chat as we go through. So the first question for the panel, and I'll go ahead and read the question, and then I'll start out with Diana, and then we'll go to each of you to answer the question. Federal funding to support healthcare came in several different forms, such as stimulus dollars and accelerated funding. What types of federal funding did your organization receive, and what's the biggest challenge that you face with those funds? And Diana, you want to start?
Yeah, thanks, Jennifer. So first, some of you on the line just wanted to share that as late as today, we actually have a CFO forum that the CFOs within organized through the Hospital Association, and we've been meeting. It started out every other week, and now we're to monthly. So just from your organizations and the intent there, it's co-chaired with myself and James Parr from Salem Health, to really just facilitate a conversation with us, because the CARES dollars are coming out so quickly. Sometimes you don't even know how they're paid. You don't know the formula that's used. You don't know if you should keep them. You have to attest to them, and the terms and conditions are pretty, I see an orange suit every time I read them, and just making sure we can attest to them as we look at our lost revenues. But I think it's been, it's great. Dollars are flooding so quickly, but it's now a reflection of how do we monitor them, how do we prepare for what comes ahead. But just want to let you know that there's a forum there that we've been meeting. So for OHSU in particular, obviously the first thing that we applied for was the Medicare accelerated payments, and for all services, whether it was facility as well as professional. So obviously big dollars went out. Also Hillsborough and Portland Adventist received them as well. And now I think we're all waiting to figure out, will we have to pay them back? I think it would be a great thing if they could be a grant versus a loan, but maybe a compromise to that would be as if they'll turn into a more longer term loan as well as a lower interest rate. I mean, we all know it's like a year and a very high interest rate. And it was kind of unfortunate. One of the first calls we had with the CFO group is some hospitals actually didn't apply just because of the steep interest rate. And it's really unfortunate just assuming they'd have to pay it back. So that's one form that we received. The other area of the general distribution fund, as we know, the first tranche of $30 billion came out based on Medicare fee for service. And then I think there was a lot of advocacy across the country that really net patient revenue was a better indicator of how to disperse the funds. So that's how the second tranche of 20 billion went out across the country. What we're struggling with a little bit is how will it be reconciled in the future? When you look at the FAQs and the documentation we had to submit, OHSU being quasi-governmental, we don't file a 990, so we had to attach our audited financial statements. And we're still working through how they'll evaluate that and come back and audit per se. For Hillsborough attaching a 990, at the time, only the FY18 was available, so that's what we applied for, but you can see language around it should be FY19. So we don't know if we'll get a true up or not, so we're trying to be conservative. Maybe that's the one advice: be conservative with what you did provide as documentation, and hopefully you can always have a pickup later if that's how it's played out. Some of the other areas that we're also working through and trying to understand is the safety net distribution. The first tranche of dollars that went out was some pretty high criteria based on your dish days and your cost per bed day, and then third was your profitability. Well, it's unfortunate that that was used for OHSU because we didn't apply. And I know now the second round of funding is based on a 5-year rolling. And now we're trying to understand, is it, as Jennifer knows, how do you look at it? Is it compounding, which is one way to look at it, or is it just any 2 years that you were less than 3%? So I think that's kind of in general just what we're trying to work through, both as financial leaders in Oregon. How can we advocate? Because I think the more money coming into Oregon, the better for all of us, and advocate for each other and support each other as we find out information. We have been trying to manage this ourselves, but have recently in the last few weeks really reached out for advice. And I think advice from one organization isn't enough. So we're using our financial auditors at KPMG, as well as Toyon, who we're working with in the future on our Medicare cost report, as well as a federal liaison, which is a Manette Consulting Group, who's very familiar with legislation at a federal level. So that's probably our advice too.
Thanks, Diana. So Maggie, tell us a little bit, how has federal funding come through for Santiam?
Thanks for including me. So I always say that we are an awkward size. And I say that because we are an independent hospital, a small system, but we're not, and we're rural from the state standpoint. So we're a type B hospital, but federally we're not recognized as rural. So we don't really fit into all of these categories. And I think one thing we've learned through the distribution of funding is that by using the types of federal divisions, there's been opportunities missed from us. And the most significant one for us was we did not qualify for the Rural Relief Fund. So we had some funding through the first round and the second round of the CARES Act, like everybody else. But then when it came to the rural relief, we had expected it, but it being based on a RUCA scoring system, which we can't appeal, we received 0. So that was really unfortunate for us. And so when you're a smaller facility, I think that one of the things we were able to rely upon was the PPP loan. So we did apply because we have 450 employees, and you need to have under 500 for that. So that was very good for us. So we were pleased to be able to apply for that funding. And when the safety net, as Diana had mentioned, the safety net funds, we actually did qualify for those. I don't know if that's a good thing or a bad thing, because that means that we had had lower profitability in order to qualify for that. But it feels as if as the funding goes, they get more defined as to how they allocate those funds. And I think that's a good thing. So currently we are in the process of applying for the state rural stabilization grant program. and we'll see how that plays out. The $50 million that the state and the emergency board has agreed to disperse or distribute to type A and B hospitals. And I am curious, and I would throw it out to others, we have been approached by FEMA, and I don't know if anybody is seeking any FEMA funding, but I find that route interesting, but fairly limited in scope. So I would say that sums up most of our funding to date.
Thank you. I know OHSU looking at the FEMA funding is something that OHSU is looking at as well to determine whether there's something there or not. So there's definitely a lot of different avenues that we're seeing, you know, throughout states and, you know, federal programs. So it is interesting to try to keep track of all of them. So Greg, what do you see for Asante?
Very similar in terms of the activity. We did apply for the accelerated payments to get the CARES fund, but there are two elements that I would add. One is that we did utilize our state legislators and federal legislators in actually helping us understand some of the elements. And so one of the things we are as a regional referral center, as a level 2 provider, and got some funding from the regional funds for that. And so that was kind of unique, and I think we were one of 7 hospitals that ended up getting those funds. And so working with the legislative process helped us in that regard. The other piece I will say is we did apply for FEMA funds. We also applied for the telehealth funds that came out of the CARES Act. And both of those are application processes, and they're geared more to the expense side than they are to the revenue lost elements that the CARES Acts have. And so from that perspective, we did start a testing site. We have an outdoor tent. We staffed it. We had supplies. Obviously, the PPE scenario, the protective equipment has been an element of cost. And so putting those all together, part of a FEMA application, it actually came to about $3.5 million for us. And so we're have that in process yet. And so we've taken every opportunity to the components we can to get grants, and we continue to explore those and submit information as it comes through us.
Great, thank you. Yeah, that's great information. I had forgotten about the telehealth one as well. There was, you know, other federal agencies other than HHS that was providing some funding, so that's a good call out. So Justin, you've got a different perspective than our providers. So tell us a little bit how COVID is working in your area. What federal funds has Centene been able to, you know, participate in? Because I would assume it's a little bit different.
Yeah, a little different. We weren't necessarily applying for funds, but you know, our focus over the last 3 months, 4 months in this COVID environment, to make funds available to those provider organizations and community organizations and members that needed it most. And so across the nation, you know, the largest Medicaid payer was definitely out front, working with, you know, all the states to make sure that, you know, PPE, right, trying to make that available and donating a lot of that to all the different organizations that, you know, needed it. And so I know here in the state of Oregon, we participated in that and made several different donations just from a PPE standpoint. And we've also been working with several provider organizations around just, you know, equipment and supplies. And as an example, you know, there's a provider down in Lane County that, you know, needed to have blood pressure cuffs to their members so that the moms, you know, that were pregnant didn't need to come to the office, but they could check their blood pressure at home. So it's just a simple thing that we tried to kind of assess the needs and let them know that we're here to help. There's also several things that Centene has done to donate money across the nation to, again, different organizations that support the homeless. And even provide assistance to those organizations that need to write grants or apply for small business loans. They've tried to make resources available in that regard.
That's fantastic. That's great to hear that other perspective. And you know, there are a lot of people, whether it's an organization or individually in need. So it's great to hear what Centene has been able to do. So thanks for sharing that. So we do have a question that came through in the question and answer box. So Maggie, this is an additional follow-up question for you. So it says, Maggie, you stated FEMA scope is limited. What is your understanding as to what qualifies for FEMA reimbursement?
I think Greg touched a little bit on that, in that it's expense. It's really temporary expenses, anything that's a temporary solution, so testing sites. And so like we opened a respiratory clinic as on a temporary location. And so the costs associated with that would be eligible. But what I feel like we have found is that I'm unclear as to whether the CARES Act funding that we have received, we would actually have to reduce that first before we would even accept the funds. And Greg, you may know the answer to this since you're farther down the pathway, because we do not have enough in those types of expenses in order to, we would never get close to what we received in CARES Act funding so far. It's been to me, very specific on PPE and testing, those types of expenses. And we wouldn't have $3.5 million in those expenses being as small as we are. So for us, it's just a matter of fleshing out whether or not we have enough of those types of expenses to make it worth the process.
Mm-hmm.
And just to follow up on the CARES Act piece, the biggest chunk or biggest bolus of support for that is lost revenue. And so
Right.
we have more than enough lost revenue to offset what we got in CARES Act. And so that's why we could take the expense side and put it towards the FEMA.
Yeah. And that's what we haven't really been able to quantify yet, because we have to see if what we've received from the CARES Act is offset in our losses, because I expect we have more losses to come to offset. So it could be.
Yeah, I mean, with the spikes that we've seen, or I don't know if it's a spike or it's just a continued number of cases as the state opens up. I mean, I think it's going to continue for a little while. So I think there is that potential for the losses to continue for quite some time. So, okay, great. So we're going to move on to our second question.
Can I add one thing first, Jennifer,
Yes.
real quick before we leave that? And just because I wanted to give kudos out to all the revenue cycle team. We've been talking a lot about these chunks of money, but as we know, there's other areas of relief, and that is the sequestration has been removed, which I think we wish would stay intact forever. But the add-on for Medicare, but the kudos is on the, and hopefully your organizations are all doing this, is submitting your non-sponsored claims. I know it's a pain to gather the data and whether it's approved and all the documentation, but I think it's better to get paid something for all of the uninsured that have COVID. So again, thanks to the revenue cycle teams who are doing that, because I know it's a lot of work.
Absolutely. That's a good call out. I mean, it's so complex, the number of things that are coming through with the CARES Act, of different things that are either new money or, like Diana said, the 2% sequestration that's been removed for a period of time. And all of those are great sources, and it is pretty complex to try to be able to track all of them and make sure that you take advantage of all of them. So it kind of leads into the next question. So the question is, how is your organization tracking your COVID recovery or rebound? Are they focused on looking at things like GPR, net revenue, margin, other indicators? So how are you tracking that rebound? So I'll start with Greg this time.
Yeah, one of the biggest things that, as I mentioned, we had was a substantial drop. We were down below 50% in our outpatient procedures, particularly our surgical procedures. And so we really started tracking just the volumes. And when they started coming back, we estimated somewhere around 1,000 cases that were deferred or pent-up demand. And so we're really tracking how that pent-up demand is being seen, and literally recovery being tracked to that. And then that translates into, obviously, margin. As you all know, the outpatient side ends up being usually pretty high margin procedures. And so it's a combination of volume and margin that we're looking at.
Mm-hmm. Okay. How about you, Diana?
So it's probably all of the above. I think looking at volume first off. We're actually, I think we all look at it daily, but also we're doing trends. We're a June 30 year end, so the way we've been defining it is looking at a pre-COVID time, which would be for us based on our fiscal year, 8 months ending February, and comparing that volume to that time period. So Greg, I wish ours was only in half. We actually dropped 75% in our surgical volume, which was a significant hit. And obviously financials reflect that at the time. So besides volume, it is looking at the net revenue. And this gets back to, you know, how we're going to account for the lost revenue. Is it historical trends or compared to your budget, or is it a hybrid? And I think there's language out there of, again, all of the above. So I think that's what we're going to do, is make sure we model everything in comparison. And then on the expense side, I know we might be getting that later, it's just tracking that over time. I think we're all seeing that spike of PPE and how much we had available to cover not only for making our employees feel safe, but ensure, you know, visitors are safe, et cetera. So I think it's really volume, net revenue loss, as well as our expense trends.
Great. Justin, how about your area? I know, you know, with a different view of how COVID is affecting your organization versus the providers, what is it that your organization is having to do in order to track COVID and kind of how the recovery is happening?
Yeah, so obviously we track on a daily basis all of our inpatient authorizations by line of business, and really have an ability to kind of look at the non-inpatient volumes that we're getting in, to look at kind of on claims PMPM, claims volume PMPM, just to, you know, day over day, month over month. And so, you know, this is something that, you know, in health insurance, there's seasonality, and, you know, definitely, you know, the first in April was the biggest hit, right? And it was interesting, the first line of business to come back was commercial. Obviously, we saw that come back in the month of May, almost back to kind of normal to a certain degree. It was interesting. And then Medicare and Medicaid kind of lagged. And then the month of June, Medicare kind of came back to, you know, pre-pandemic levels. And then now in the month of July, we're finally seeing Medicaid kind of come back. And I'm talking on the inpatient side. So it's interesting, the lag that's happened over the last 3 or 4 months. But what we're seeing, you know, it is kind of getting closer back to that normal. It's still a little bit off, but looking at those inpatient metrics, and even, you know, so another metric we look at is just the use of telehealth. It's amazing to see the low adoption beforehand, but a lot of behavioral health providers, you know, we're seeing like 85% of their claims volume coming through via telehealth. I mean, that's just, it's a phenomenal change that we're seeing in
Absolutely, thanks. Yeah, telehealth, I mean, that is such a great transition for, I think, all of the United States on how we're moving very successfully, from what I can see, to a more telehealth environment. And so that is definitely, you know, a valid option maybe for the future of healthcare, is to continue that telehealth. So, you know, it's interesting that you had that call out on behavioral health. So yeah, definitely. We want people to feel safe in the environment, but still get that care that they need. So awesome. So Maggie, do you have anything to add on that as far as kind of how your organization is looking at tracking COVID and the recovery and how you're rebounding?
You know, there's really nothing different that we're doing that they haven't already spoken about in regard to hospitals. I would say our clinic, we do track our telemed, as you said, and making sure that it's being utilized and seeing increasing volumes there. I think we're really focused on, is this a U? Is this a V shape, or is it an L? And the fear is an L. I've appreciated the Oregon Association of Hospitals compiling data for us. We still have we're about 35% off in our ER activity. And so it was helpful to see what's happening around the state with other area hospitals and their ERs. You know, a lot of us are seeing some increasing in our surgical areas, but our ER is still way off. And I would say, so we are managing and looking at all of the indicators you had asked, and I would also add that cash is king. And so we are always aware of what our cash position is as we're going through all of this.
Mm-hmm. Absolutely.
Yeah.
Great. Thank you, guys. Thank you for sharing that. So one thing that you saw in the word cloud before we got started was, some people mentioning things like work from home was one of the things that is being viewed as a way to, help manage cost. So in that new environment, how are you sharing results with your employees in your organization and helping them stay connected with what is happening with COVID across the state within your own organization? So how do you share those results? We'll start backwards. We'll start with Maggie.
Sure. So we have, when COVID first started, we started a COVID task force and appointed 2 physician leaders to lead the task force. And within a few days, we started a daily update. So we have our COVID task force update. It has now gone to weekly, but it did begin on a daily basis because things were changing so quickly and there was so much information to get out to staff. We also hosted virtual town halls. I think size is where we can be pretty nimble. We can use lots of mediums, and found those to be very successful using a chat mode. So people can ask questions and make it be a virtual Q&A, like kind of what we're doing now. And those were very successful. So I would say mostly by updates, whether they're daily or whatever that may be. And then of course, all of the other normal types of distribution of information.
Excellent. Thank you. Thanks for sharing. Justin, how did you guys share within your organization? Knowing Cenetene is kind of more national, how did you guys share information about what's happening within your organization as well as just the pandemic in general?
Yeah, prior to the pandemic, our local Oregon team, we would have quarterly all-staff meetings all together. Once the pandemic started, our CEO decided to do weekly all-staff meetings. And so every week, we're about 350 individuals across the organization. We're all on a call virtually. It's been amazing to just, with everyone, because there's a lot of questions out there and a lot of information moving quickly. But we found it very successful to actually bring the organization closer together during this time of uncertainty. And it was really kind of a ask, the leadership team anything, right? Obviously we'd have some updates, from a national, state, and local level around COVID and what we were doing. And but it was really just an opportunity for the employees to just, kind of have a free flow dialogue with the leadership team. And we still do it to this point. We're still doing it every week, 3 or 4 months later. And eventually we probably will kind of slow it down, but it's just been, it's really kept the broad organization together during this time. So.
Yeah, that's great. I mean, to use technology to get there, I think is fantastic. And if you still have robust participation in those meetings, even, 3-4 months out, that's pretty impressive. Pretty impressive. Yeah. People start to kind of lose that interest if they don't see, the huge things happening. So great. Thanks for sharing that. Greg, how is your organization handling communication and keeping everybody connected?
Yeah, a little bit different twist. We actually did put our emergency preparedness function in place. And so we had incident command. And as part of incident command, we have a communications arm to that. And so there's been communications and newsletters and so forth to our employees, to the community. And then we're Region 5, we're the hub for the emergency preparedness. And so out to the whole region. And so it really comes through that structure that we end up having it.
Great. Thank you. Diana, how about for OHSU?
Yeah, I think I'll take a little different spin, knowing very similar communication internally, but I'd say a positive thing that's been occurring is our CMOs across the state, as well as our COOs have also had weekly calls and how they work together. And I think a positive outcome of that is now there's actually through our GE relationship, where we can see the beds for everyone who's participating, which every hospital is a statewide census. You can see it by region. And this is really to help us together how we manage a pandemic going forward. If we have another surge, to understand where the ICU capacity is, who's on respirators, et cetera. I just think it's been a great outcome. Unfortunately, what we had to go through to get there, but how we really solve and take care of Oregonians. It's really, we're trying to reflect on the positive. So I think that's how our communication as leaders has really, I think, increased during this time.
Great, thank you. So before we jump to the next section, does anyone have any questions that they would like to ask? I've been monitoring chat and the Q&A. We haven't had anything posted for a little bit. So just a reminder, if you do have some questions, please feel free to put them in chat or the Q&A, and I'll pick them up from there. But we're going to jump into our next stream of topics, and it's the operational questions. So kind of stepping away from those CARES dollars and, how we're managing some of those dollars and going into some operational thinking. Do you think there will be nursing units in your hospital that will only handle COVID cases as you're planning for the future? So will you have specific COVID units in your institutions? So we'll start with Greg.
Yeah, as a matter of fact, I mentioned before the emergency preparedness, and part of that, way back when Ebola hit, we actually had Ashland, one of our rural hospital, designated as a center for emergency preparedness. And so they're the transport, or the hospital gets the folks transported to in terms of COVID cases. So we have a unit there, that's the COVID unit, and if we have any hospitalizations, we tend to utilize that. There are exceptions. There are disease classifications and others that require special care. It could be at one of our other hospitals, and then they're treated there in negative pressure rooms and things of that nature. So we have a regular structure, which includes the incident command daily, bed review, and the whole process of where the patients go and how we are able to handle that load. So that's part of our infrastructure during this period.
Great. So Maggie, how are you guys handling that? Or do you have a specific unit just for COVID patients?
So I'll go back to my original statement. There'll always be a theme with me, and that is we are that awkward size, right? And so we're not very large. So we have 2 floors for medical surgical. So one is designated, COVID available, and the other is clean, and it separates. So we have separation by floors, but that's really all we have. And so if we were to become, I think if there was a surge, we've designated the top floor, but then there's limited numbers of patients. And so it's so much is dependent upon volume. But for now, we've been able to keep the separation, which I think has been very good for our community. It's so much is just dependent upon what's to come.
Mm-hmm. So if that floor that you have that is for the patients that are COVID, if it's not full, are you able to use that floor, or are you not able to use that floor?
We have used the floor. We separate between ends of the building in between, so we still have the ability to use it because it's really all we have.
Yeah. Okay. Great. Thank you.
Mm-hmm.
Diana, how about for OHSU?
Yeah, we're in a unique situation. I think there's only one other hospital besides OHSU that has actually semi-private rooms. So immediately when COVID hit, we lost 22, 25, however many you want to count it. So for us to lose that many beds is significant, already being full. So really valued the state's support in using other areas of the hospital, temporarily for inpatient. So we were able to convert our what's called the overnight care unit, which is in Center for Health and Healing at the bottom of the tram, that we're actually using that for inpatients, a 24-bed unit. So that's how we've been able to adjust for the loss of beds, but it's really particular management to the airflow, as Greg was stating. It's very important of the rooms that are applicable for this care. And there is designated rooms, but it's really managing this. And as I was saying, that's why the statewide census is so important, so that we all work together in how we're managing that. And if we have ebbs and flows, and I just have to throw Matthias Merkel, Dr. Merkel, he's from Germany. He says, I wish we could do this across the country. If you think about it versus why do we have just the borders of Oregon, and that's really provocative for us because, I just came back from Arizona, and you probably said I should be quarantining myself for how the numbers look down there. But, could Oregon help Arizona? Really thinking broader, again, about the safety of patients and our employees, et cetera. So it was very provocative, but it's actually a great question.
Mm-hmm. Yeah, I think the tools that everybody has to use to manage those beds and make sure the beds are, being used in places where they're needed are definitely important as we move through this. So, Justin, did you have any points you'd like to add to that conversation?
No, not really.
That's okay, no problem. So we did have a question come up in chat from Chris. He's asking, how is each organization handling testing during the COVID pandemic? So Diana, would you like to talk a little bit about OHSU and our tents that we have in various places?
Yeah, I think we all, just a pent up demand. And I think our challenge, besides having the respiratory clinic, like Maggie articulated, our testing sites, is that we can't keep up. And we're actually seeing patients who technically haven't had a historical relationship with OHSU. So it's definitely been an interesting there. For some, I think all the protesters are impacting our sites. And so actually we had to cancel surgical volume because we can't get the tests done fast enough. Exponentially, they're growing. And so it's really the surge of testing. How do we keep up with the volume and the care that we need to provide? It's really a challenging daily, back to incident command group that's working through that.
Okay. Greg, how about you guys? Are you having any pop-up tents or any quick locations that people can do a drive-by for testing or new lab areas?
Yeah, at the peak, as I mentioned, we had emergency. We did have the tent at the peak of the pandemic. That when it started to slow down a little bit, we actually took the tent down. We incorporated a number of procedures, though, and the main one is that anybody that has invasive procedure at our facility does get tested. And at least it's within 48 hours of when they're going to have the procedure. And so that is happening on a routine basis. Anybody else that is associated with employees and so forth that have any symptoms, we get tested. And one of the biggest challenges we're starting to see is the testing supplies, and actually having some issues in terms of securing those. And so hopefully, knock on wood, that won't be an issue down the road. But we're starting to see that a little bit. The other thing I would say that, though, in the overall communication to the community, the testing is one aspect, but the social distancing, wearing the mask, and then the ability to monitor trace are important factors, and we spend a lot of effort in those arenas also.
Mm-hmm. Yeah, I've been watching some of the news feeds that come across, and I think that what we're seeing with the added testing is what's happening across the United States from a standpoint of, will we have enough test kits for everybody? And, kind of getting to that phase again where we were at the beginning, even though, there's more test kits available, there's more people being tested. So, definitely.
There's a whole discussion on the antibodies and whether that's valuable or not. And so it becomes a
right.
Another discussion, another day.
Yeah, exactly. Justin or Maggie, would you like to add to that?
Yeah, Justin, I'll go first, and then maybe if you have anything, because you may not be a site. So it's interesting because being smaller, all of our testing supplies are getting redirected away to, and we've been experiencing this from the start. And so we've been fortunate to have enough rapid testing to do our surgical patients and our inpatients and staff, quite honestly, because that's a big issue, is when you're small, you need to get your staff back to work. And we've had, some positives within our staff. One thing that we're doing is trying to, and we're almost there, we're super close. We're actually getting emergency authorization use for in-house PCR testing. So we partnered with Corban University, which is a small university in Salem, and they have a a professor, a biochemist professor that happened to have a PCR machine that could be applicable to COVID. So our lab has been coordinating with Corbin, and I would say by the end of this month, we will be able to do much higher volume of testing. And the beautiful thing about it is, and you guys, I think you're doing this at OHSU, and OSU is already doing this, is it uses saline as a medium as opposed to the reagents that you need that are in such high demand and are in low volume. You know, they're not available. So we have not had testing sites open yet, but we anticipate being able to open testing sites. One other area that's been, I think, really helpful in Marion County, and I can't speak to the rest of the state, we're partnering with other groups in the county and a company called Alluvium, and I think Salem Health has been very actively engaged in it, and Yakima Valley Farm Workers. They actually have mobile units going out to farms and other areas that are at high risk. And so a lot of our medical personnel are volunteering to go out and do mobile testing. So there's been some interesting things. I think Diana was talking about how it's one of those things that either brings you together or tears you apart. And I think as a medical community across the state, I think we've been able to see us all come together very well and support one another. And I think the mobile testing is an area where we are trying to work more collaboratively with the county and other groups that have access. And having in-house access, we hope to be able to help facilitate better testing.
Mm-hmm. Yeah. Great call out on, kind of that coordinated effort of working together. So, yeah. So we've got a couple of questions that have come up in the chat as well as the question and answer. So, Justin, I'm actually going to start with you on this one. So there's one in the Q&A. It says, how would you rate your preparedness or the entities you work with on preparedness with PPE, beds, ventilators, etc.?
Great question. That's something that we've, like I kind of said earlier, we've tried to get a pulse on all the different hospitals across the state with whom we do business, just to make outreach and say, hey, we're here, we'll provide, what you guys need. And for the most part, I think, folks have definitely been willing to accept donations. And, I think just keeping that line of communication open has been helpful. And for the most part, we've been able to meet a need. And as it stands right now, it seems like the level of I guess, preparedness is better than it was, right? I think, not just our plan, but I'm sure many other entities have been able to donate PPE across the state. And so I just think, I think there's probably still areas of opportunity and areas of concern and vulnerability, but for the most part, it does seem like it is getting better. But I guess it would just, I'm assuming it can turn pretty quick. And so I think Cenetene as an overall plan, their mantra is just to stay vigilant with partners to make sure that they know that we are there to support and have access to PPE. We've been able to solicit and get access to this in quick order. So.
Yeah, so it kind of as a follow-up question, so as you reach out to those hospitals that you interact with, do you feel like they're able to actually respond to the question of their needs? Do you feel like, kind of looking at it from a non-provider, do you feel like they know what their needs are and where they have deficiencies or less supply?
Yeah, I think it's kind of a mixed bag. It does seem like, some of the responses that we've gotten is, yeah, we'll take it, kind of like, sure, if you're going to provide it. And some are, yes, we are in dire need of this. We could really use, X. And so I just think it, it's across the board. Maybe the more rural areas, to assess. It's kind of a mixed bag.
Okay, great, thank you. So Greg, how is Santiam kind of responding to that? How would you rate your preparedness for PPE, bed capacity, and ventilators?
Yeah, at Asante, we haven't had issues with ventilators. We have plenty. PPE, we typically run between 30 and 60 days supply. We actually established, and part of our FEMA dollars was a separate warehouse where we house a lot of the equipment. And so we actually had some short-term rental space downtown Medford to do that. And so we're in good position there. As I mentioned earlier, our biggest issue or concern is around testing supplies for the lab.
Excellent. And Maggie, how is Santiam doing as far as how would you rate your preparedness?
I think our preparedness is very solid. It's just access to PPE and access. Okay, I'm going to say it again. Being small, you don't have buying power. We do not wield any form of buying power in the market, and so we struggle to get supplies because they get sourced elsewhere. Understandable. So we have to get creative in what we do. Ironically, we had happened to have, tens of thousands of masks on hand when this all hit. And had we not had that, we would be in a much worse position. And so we are okay. The funny thing is the things that you don't think about that are not available. So gowns, we're having a horrible time with disposable gowns and booties and all those you can work around those things, and they're not the necessities. They impact your organization every day. So I would say we are struggling it's a scramble to get PPE for us. But we're prepared if we have a surge, we're prepared today, and then never, 2 months from now, will we still be as prepared depending upon what's available during those times? I think the testing supplies, as Greg is talking about, is really the biggest issue that we're all facing equally. So.
Yeah, absolutely. And Diana, how about at OHSU? How is the preparedness on PPE and making sure that we have all of the equipment that is needed?
Very similar to what everyone's saying. We're prepared and always report out how many days out we are. I think it's the biggest thing is what's ahead, and are we prepared for that? I think it's the most uncertainty I think that we all have.
Excellent. And I know within OHSU, as that is my place as well, we do have daily communications where people can go in and look at a PPE dashboard to see, what we have available. And so that it helps the employees understand kind of what we have and really helped ease some of that anxiety that people may have had about, I don't want to go to work because I might not have the protection that I needed. And so it was nice to see that dashboard so that they can see the visual of what is available. So that was nice. Okay, we're going to flip to kind of two questions that are a little bit more financial instead of operational, coming in from both the chat and the Q&A. So one of the questions is, how has COVID affected your cash on hand? Diana, would you like to start?
Sure. So I think that's why the Medicare accelerated payments were so important at first. Obviously, that was a great influx of cash. However, with lower volume, obviously, there's less cash coming in for that patient activity. And I think that's where we were worried of just sustaining cash, as well as I know this is coming up later, our commitment to our employees. So some of the expenses were not flexing down with the volume. And so the implication for that, you just needed to monitor it consistently.
Okay. Justin, how about at Cenetene? Is there, cash management and participating in some of those federal programs might be a little different for you guys. How does it look for you?
Well, a large portion of Centene's membership is government sponsored, right? Medicare, Medicaid, and even on the individual side. And so we have seen, we have a little bit of, here in Oregon, we have a little bit of group business. So we've seen kind of the impact of, members, falling off the rolls of groups and moving to the unemployed and onto Medicaid. And so one thing I would say is, we're obviously a Medicaid plan in the state of Oregon, and what we're seeing across many states is states taking a look at their budget and looking at rate adjustments, right? So that there's been somewhat of a utilization reduction in the from April and May.
Mm-hmm.
And so OHA, the Oregon Health Authority, has proposed a retro rate adjustment back to the beginning of the year.
Right.
For the fact that we are keeping, as part of to receive additional dollars from the federal government, requirements is to keep folks on the Medicaid rolls, and not redetermine them off. And so as part of that, the state has kind of made the assumption that, hey, CCOs, your risk level of your employees it's actually getting better, because those people that usually fall off the Medicaid rolls are less risky. And so because of that, they've made some adjustments to our revenue, or will be coming up shortly. So that's one of the things that, as you can imagine, that Cenetene is trying to manage across all of the different states, as the states kind of look to how to fund some of their budget shortfalls. So.
Mm-hmm. Yeah, and I think that, the retro adjustment that you mentioned, it was announced a couple of weeks ago of a reduction in what is available in the funding to those CCO organizations. So it will be interesting to see how that plays out and how everybody can manage through that. Greg, how are you guys doing with cash, and how has COVID affected the cash for your organization?
Yeah, obviously it's some of the similar story, but we've had a little bit of what I'll call a fortunate scenario. Again, the advanced funding helped from Medicare, but we are also accumulating cash for a large capital project. And so we had the cash there available for this, and with low interest rates and the fact that we just went to the bond market, we were able to increase our debt borrowing to the extent that we were tapping into our operating fund for cash as part of our capital project. And so it just happened to be fortunate timing of what's going on in the finance world at Asante that ended up pretty well in our scenario.
Okay. And Maggie, how about you guys?
Yeah. So I would say we track our operational cash and then taking away, if we had not received any CARES Act funding or the safety net, I would say at this point we are now into our reserves. And again, being small for us, it's a matter of whether you can stay independent and stay on your own by your cash position. And without funding sources, out federal or state funding sources, I would say we would be in a very precarious position today without that funding. And so fortunately, our cash position is fine right now, and we're tracking it and we keep it, but we're tracking it operationally versus with the CARES Act funding. And it's really not a pretty picture. The downturn in activity has affected us greatly.
Mm-hmm. Yeah. And, one of the pieces of the CARES Act is that the delay in the payment of payroll taxes. Are all of your organizations participating in that part of the kind of cash management, is to not do the payroll tax?
We're not.
So OHSU is, I wanted to kind of flip almost another question. We're talking about the balance sheet on cash, but I think where we have more uncertainty is more on earnings going forward. I mean, we're all used to at least having a positive bottom line, but when you have a negative bottom line, and so what will the rating agencies as well as our debt covenants accommodate during a pandemic, and hopefully they will. I mean, normal state, if you don't hit them, that's a big, huge black spot for everyone. But OHSU, if we lose 95 million instead of making 100 million, I mean, that looks very different, but we all know why. So your balance sheet could look okay, but the earnings is what looks, we never thought we'd see red numbers this big. So it's I'm just curious, it will be interesting what happens in the market and if there would be waiver on all of our debt covenants just because of this pandemic.
Mm-hmm. Yeah, that's a good call out. I mean, there is that aspect of it as well, as making sure to manage the expectations, and if you do have debt, how to manage that expectation. So thank you guys for sharing that. So another question that has come up in the chat is related to self-pay. So there's a lot of conversation that with all of the unemployment that is been pretty public as far as, understanding or hearing that there's a lot of individuals who are losing their jobs throughout Oregon. We keep hearing that, self-pay balances are rising. The use of self-pay, or of Medicare is also rising. Is that true? And if it is true, what in each of your organizations doing to manage that piece? So what are you doing to manage self-pay as well as possibly additional Medicaid? So do you want to start, Greg? Have you seen any change in your mix of your payer mix?
Yeah, we have. The month of June financials, we actually saw a small shift from commercial to Medicaid. And so more CCO activity on our revenue side. We haven't seen a big increase in self-pay balances yet, but that would probably be coming down the road in terms of the copays and deductibles and how insurance plans would change that element, although the payer mix has changed in our case. One of the things to offset, though, that we are focusing on a little bit more and putting some effort into is our upfront cash collections. And so
Okay.
Your co-chair on the committee is very much involved at Asante in that.
Yes. I'll ask Aaron about that later. Excellent. Maggie, what do you see in your environment as far as increase in self-pay or the Medicaid environment?
It's interesting. We had this conversation on the CFO call this morning, and what I would say is this similar to Greg, just a slight shift to Medicaid, nothing significant. And I think it's too soon on the self-pay as well. So we have not seen anything dramatic to this to date, but it's too soon to tell, really.
Mm-hmm. Okay. And Diana, how about for OHSU?
Yeah, I wanted to add, I think us as an industry, and I think all of us in Oregon did this where we weren't billing our self-pay balances once the COVID hit. And I think we're now gearing that back up. So I think that was a great, again, humane effort of not impacting individuals personally at this point. But now it'll be interesting to see, does bad debt rise during that period that we didn't bill?
Yeah. Absolutely. And Justin, I think we're
also had the requirement for COVID.
Oh, sorry. So Justin, I think we're all interested in seeing what Centene's perspective is on it. Do you see a growth in number of Medicaid covered lives?
Yeah. There's been many done around this, the impact of unemployment across the country. And obviously, Centene's very much interested in this, given the potential impact that it could have, temporarily to the enrollment. And we have seen it, it rise pretty, I would say, in line with kind of what we thought. I think here in the state of Oregon, at least for our CCO to see the impact related to the unemployment and the Medicaid. I think for whatever reason, it hasn't been as big as what we had anticipated. I think in the state, there was something else that was done that there would be an additional 200,000 lives added to Medicaid, 200,000 lives. And we haven't seen that, obviously. Right. I think we've seen, 40,000 or so, maybe. And so, but I think, across most states, they are seeing a pretty significant impact. Oregon's unique in that there's so many CCOs, right? There's 15. Most other states, there's typically 3, 4, or 5 at most. So the membership impact is definitely far greater. I guess there's a lesser amount. So
great, thank you for sharing. I think we were all hoping that you had a little insight to tell us, is that 200,000 actually a true number or not? So I think the 40 that you mentioned is the same that we're kind of hearing and seeing. So maybe not quite there, which is great. I mean, it's great for the citizens of Oregon, if we, continue to have people employed or they have coverage from another source. So
Yep, exactly.
All right. So yeah, Diana, go ahead.
Oh, I was just going to add another theory out there is some of the folks on unemployment didn't have insurance in the first place.
Mhm.
So we won't really see the shift, but it's just a matter of then now we see a growth in Medicaid or not? And then also, will they actually go into the exchange instead of Medicaid
Oh,
or
that's
some
true.
sort? So it could be a hybrid, exchange. Reimbursement isn't as great as commercial, but at least it's higher than Medicaid. But yeah, time will tell.
Yeah.
You know?
Yeah. Well, and definitely, I mean, even you think about some of the industries that have seen the harshest cuts when you're talking about restaurants and food service and some of the other service industries with hotels. They may be some of those lower paid individuals who were already one of our covered lives. And so it doesn't add more covered lives. They just continue. So, okay, great. Thank you. So we want to get into a little bit of our labor questions, so we at least can touch on that topic. Before we started our panel today, you saw in our menti.com some of the information that the organizations or our members stated on how costs were being managed through COVID. And there were a lot of words that popped up like layoffs and furloughs and so forth. So how has your organization handled labor management? Are you using layoffs, mandatory vacations, early retirement? What modes are you using? And I'll go ahead and start with Justin and see if you've got something to share from Cenetene.
Yeah, so as long as our membership stays where it's at, from a stability standpoint, obviously we're gonna need the folks that we have, and so as our membership shifts up or down, that's really when we would look to adjust our staffing levels. And it's been fairly stable throughout this. As I mentioned, we really haven't grown a whole lot on the Medicaid front, and our Medicare and commercial groups stayed fairly stable. So it really, we haven't had a whole lot of, extra things that we're doing. And so one positive thing in all this is the amount of travel that we have saved. I mean, we basically non-existent. We're
Right.
About $1 million a year in travel, right? Just going amongst our different sites, and that's practically gone to zero. It's amazing. So it's kind of a, we're definitely talking internally around, our travel, requirements look like, post this pandemic, right? And do we really need to travel as much as we did in the pandemic? So.
Yeah, and it's so true. I mean, I think 4 out of 5 that are on the screen are working from home. And so, that's, it's almost like going to the dentist, right? 4 out of 5 recommend working from home. So, yeah. So Greg, what have you guys done at Asante for labor management?
Yeah, basically, we haven't done a lot different than historically. We've kept our productivity components in place. We've kept most of our staff on the payroll, and particularly those that had any symptoms or suspicion of COVID. We basically paid them while they were on leave. We want to keep the labor force intact for what may come in terms of preparedness. And so we really did very little. As a matter of fact, we spent about $2.5 million in terms of labor-related expenses, either admin time, some support in childcare, and activities like that in order to keep the workforce whole through the period. We took the approach that we knew it was going to be somewhat of a short-term component. We had the financial reserves to do it, and so we kept that kind of strategic direction as part of the pandemic.
That's fantastic. That is great to hear. Maggie, how about for Santiam, how did you guys react and what have you done for labor management?
I would say very similar to Asante. Our first goal was to keep staff whole as best as possible. And so when everything hit and we had to shut down our ORs, we reallocated our OR staff, trained them up on the ICU and in the ER, and formed a labor pool. And I'm sure most everybody did. We are unique in that we are non-union. And I say unique, I mean, I feel blessed. We're non-union, and so we have a lot of flexibility. And we have not had layoffs to date. We have not cut salaries to date. We have not cut provider salaries either. And they were the first to step up and indicate that they would be, if this is what we needed, this is what we would do. Because we received PPP funding, we were required to keep the staffing levels at current levels. And we made that decision before we were funded. And so in receiving the funding, we felt very fortunate that we were able to keep everybody intact. So our goal is still that, and we hope to continue as we see our activity coming back, although our activity is not back to where it is still, we're still on an operating loss. And so if we start to see activity coming back in, and we won't have to make any adjustments. I will say the only thing we are really focused on is ensuring use of PTO. That's the one area where the liability has grown too large. We've been messaging the use of PTO and mandating it. But other than that, we've been pretty fortunate. So
interesting. Okay.
Yeah.
Great. Diana, how about at OHSU?
So we were committed to our employees as well. So we guaranteed all employees, whether they were working or not working or unable to work because volume wasn't there to support it, to continue their salaries through the end of June. And that also included those of our resource folks as well. So it was, and the main thing there was just to commit to keep stability as well as confidence as we move forward. However, we kind of have a phrase, we're going to tighten now and loosen later. So we implemented a pay reduction to all non-union employees as of the month of July. We also have assumed we would not pay incentive as well this next year. So it's pretty tightening for all of us. It does include our faculty. Since we are a union shop, it doesn't include that population. So it's leadership, management, as well as our faculty.
Okay, thank you.
Well, then the other thing we have implemented volunteer retirements for all employees. So, that could be good and bad. It could be in a position that we might just have to backfill. So we're working through that with our unions and how we'll proceed. So our number one goal is we want to avoid a layoff, but trying to manage through this again with those unknowns of the payer mix shift and Medicaid rate cuts for calendar year 21.
Okay, great. Thanks for sharing that. So Maggie, as you were talking, it did pique my interest on one thing that you said about encouraging individuals to take PTO. One of the questions that were submitted by our members earlier was kind of along that lines in how are your institutions handling both physician and staff burnout? When they're in a pandemic, they want to do everything they can to help all of the patients. So how are you managing burnout?
It's interesting because the term burnout, I think the initial onset, we were preparing for a surge that really didn't amount. It really didn't come to fruition. And so I would say I guess I have to clarify what burnout is, because I know like in our clinics, they were kind of sitting around. I mean, we were still seeing patients in our clinic, although the respiratory clinic was taking what would have been considered symptomatic potential COVID patients. And so I would say most were really interested in jumping in and participating. Our providers were trying to work in the ER and work up on the units and get reacquainted because their clinic activity was so low. And so what I think, but now what we're seeing is the main focus area where we're seeing burnout is in our lab. And I think we are trying to ascertain how to better support a small department that needs a specific help. I think that is the one department that has been most overwhelmed in our area. So I don't think we've really hit a burnout phase. I think what we're seeing is just general angst. And I think people are just much edgier than they typically are. And so it has caused other things and other emotional outcomes as opposed to the actual burnout of the work that's been involved. Because in most areas, our workload is still very light. So,
Yeah. Well, I think, you have burnout in doing your work, and that's normally with the assumption that your home life is pretty normal. But now with
Right.
home life being different as well, it's almost like it's adds to that additional difficulty of I'm working as hard as I can and I get home and things are not normal.
Right.
And so that adds
Right.
to.
And I think that's a very different question. And I think that, we have behaviorists available for staff that are struggling because I think the general angst is very prevalent. And I think people are feeling it, whether it's either work related or home related or just COVID related in general. And so we have some, resources available for behavioral health for all either providers or staff. And so I think that the work may come that we will see burnout because I think people are feeling like this is not ending anytime soon. And I think we're now into this, we thought we would be done by now and we're tending to ramp up. And so I think that that's going to be an interesting question to ask, in the next few months to come.
Yeah, absolutely. Thank you.
Yeah.
Now, Diana, I know wellness is a big piece within OHSU and, a big thing with faculty. So tell us a little bit about OHSU and faculty and staff burnout.
Prior to COVID, I think we were all worried about burnout. And I think particularly in the medical school environment and our residents, the heightened stress and suicide rates, et cetera. And so now COVID hits and it even compounds that. So there's a strong emphasis just focusing on our faculty, our providers of just what we're all going through. But I would extend it. I don't think it is just our faculty, it's all of us. I think in this new environment, why I need to go into the office every 2 days is one thing I have to pick up my printing because I can't figure out how to print from home. But it's we're social people, and I need to be kind of social on virtually, but it's hard to sit in front of a screen all day long. You need that break or walk around the hall or say hi to someone or, a hug. So I think it's emotionally the need we have as humans to interact is going to be interesting how we transition. I know it can work, but need to balance all of this a bit. So I think we all need wellness, and I think that's during our teams who we work with. I do think there's some, when we worry about our kids always on the cell phone, I mean, now adults are on their laptops. So how do we, that social distancing of 6 feet apart, but how do we want to engage with each other? So I worry about what this is ahead, and maybe we have to live in a COVID world going forward. What does that mean? And how do we adapt and keep people safe, but still meet the needs that we have?
Yeah, absolutely. I told my husband the other day that I might get tired of seeing him all day, every day. So that's what happens when you're in the same space together a lot. So Justin, what do you see for Cenetene on staff burnout? Are you seeing that or experiencing it within your organization?
Yeah, I think, with the onset of COVID, there was so much activity just in terms of trying to figure out how to address all the different needs that had come up with provider community groups and just, everyone was just kind of running around with their hair on fire. And so I think that has kind of subsided to a certain degree. I think, at least on the insurance side, it's, we have encouraged folks to take advantage of PTO during this, these summer months, and really, because again, we don't know, what the next, 3 months, 6 months look like. And so definitely encourage to do so. And I mean, we've all kind of gone through, it's been a crazy year for everyone. And so, continually encouraging folks to take that, relax, because I'm sure the next 6 months will be, busy as ever.
Yeah, absolutely. Greg, how about for your organization, and what are you doing for burnout? Are you seeing burnout within your organization?
Yeah, very similar to some of the other responses. I think there's pockets of individuals that have had a lot more stress in their lives, and just the longevity of COVID and how long this will go on is just something that we're all adjusting to, and it gets old in the news and it gets old in our lives on a daily basis. So.
Yeah, that is so true. So true. So you guys have been doing an absolutely fabulous job, and thank you for answering all the questions, especially the ones that have come through on Q&A and chat. And I think we've got time for probably one more question. We weren't able to get to all of the questions that people submitted. I think there's a few that I wasn't able to bring into the conversation. But it definitely shows that our membership, as well as probably all of the employees throughout our organizations, are very interested in what does the future really hold for us in this new COVID time. So I want to make sure to take a moment to just thank you guys for your time before we get into our last question. And you've really been great. And I have a feeling the membership is going to ask for us to have another session like this and invite some folks in, because definitely there was a lot of great questions and feedback. So that is fantastic. So our last question is kind of a two-part question. So one from the one that was provided during our polling before the conference, and then one from the Q&A. So basically, what keeps you up at night? And what's the biggest challenge in healthcare in, I'm going to say post-COVID, but we know that COVID is not probably going to go away. So what keeps you up at night in this environment of healthcare?
Well, I'll start.
Okay.
The impact of the economy and what that's going to mean to healthcare, I think, is the biggest unknown. We talked a little bit about the shift in payer mix. We talked a little bit about self-pay and what will evolve there. The general economy of industry and employers not being able to have the same kind of benefit structure, what the state is going to have in terms of a budget, what the feds will eventually have in terms of a budget, are all factors that is a big unknown. And so the future impact of all those things coming indirectly out of COVID, that's what keeps me up at night, and that's what I think is the unknown that kind of in the room.
Absolutely. How about you, Diana? I know there's nothing that keeps you up at night.
Yeah,
that was sarcasm.
Besides what Greg mentioned, I think it's just wanting to continue to provide our mission. I think that's why we're in this job as CFOs, of supporting the frontline staff who are taking care of Oregonians, ensuring we can continue to do that, in a safe, whatever. There's going to be something else besides, there was Ebola, and now there's this, and there'll be something else. So how do we can sustain? And I worry about some facilities, like Maggie was saying, just worrying about, having to close if they don't have enough cash. And obviously healthcare is a big employer in many communities. And so with facility, that's just really challenging. So I worry about that. On a different notice, I worry what restaurants won't be around. I know I can't go to Sweet Tomatoes anymore, but so what's going to be what's the restaurants that I like that won't survive, which is really sad to think about that. But maybe there's a new restaurant that will pop up and hit the market for us. So all of the above.
Excellent. Justin, how about you?
Yeah, I think obviously the economy is a big thing. It impacts so many different facets of our business. And so I also worry about just, some of the that we've made on the CCO front and just in healthcare in general around improving the lives of the members that we serve. And so we made a lot of great strides in terms of the quality aspect, and in this new world that we live in, how will that impact, the efforts and the strides that we've made to date, and will it set us back? And so it also creates an opportunity how we, think differently in how we care for our members, and how the payers interact with the providers. I think it's a huge opportunity to kind of sit down and think about how we can, come up with different, more creative strategies going forward. Like how telehealth has kind of introduced this, option, which is kind of transformed, and that's one thing that I hope we can kind of continue to advance in that, and additional opportunities in healthcare that perhaps have kind of lagged and just haven't had. So,
Excellent. Thank you. And Maggie, what keeps you up at night? What do you see as your biggest challenge?
Sure. I think it's funny because whenever I'm asked that question, I always like to say, kind of what keeps you up at night is also what gets you up in the morning. And so for me, what gets me up in the morning is, I will go back to what Diana said, is that what keeps me up at night is will we be able to remain independent and keep serving the communities that we serve, and can we financially do that in a way that's healthy to the community, in a way that is comprehensive enough. And so that keeps me up at night, but it also gets me up in the morning to make sure that we can still be here. And so I'm hopeful that that is what our future holds.
Yeah, absolutely. That's a great call out. I like that. What keeps you up also gets you up. That is very true. So, well, thank you guys for a great conversation. This was fabulous. I know our membership was very appreciative of the information that you had to share. And so we appreciate your time. I know your time is always valuable. So thank you for participating, and thank you for allowing your staff members to participate in Oregon HFMA. I know many of them were on the call and were on the conference, so appreciate that. So those of you who are still participating, please make sure and look at the chat. We have posted the survey link. We'd love for you to complete the survey for this particular session, as well as the one that comes out on Friday for all of the sessions. We do have another session coming up for our conference. It is the problem solving session that will begin at 4 o'clock. And so we hope to see all of you there for that as well. And thank you to all of our Oregon chapter sponsors who have participated in this, our virtual conference, our first virtual conference. I think it's been going very well. And so I appreciate everybody's time. So we are at the end of our hour and a half. It went fast from my perspective, and so I appreciate you guys being here, and hope you have a great afternoon.
Thank you so much.
All right, thank you.
Bye-bye.
yeah.